Hi there, welcome back. I'm Sean Osterlink, and this is Overcoming with ACT. Today, I wanted to talk with you about what we as therapists are writing about if we take notes during a session. I, for one, do take notes during a session. I write quite a bit, I write too much. I should probably do that less, but nevertheless, it's the habit that I've gotten into. Um, so notes. Some therapists don't take notes at all. I remember in my master's degree in the training program that there were professors that at least we'd heard about that didn't want people taking notes at all. That it was better to be able to not depend on that, to just be fully present with a client, that even a pen and paper would get in the way of that process, and that it should just be just you and them directly, and not looking down to write something down during a session. And so we, if I'm remembering accurately, I think we practiced some of that. But at some point along the way, I definitely got myself a notepad and started taking notes to help me keep track of information, um, to be able to formulate things along the way. And yeah, so that became a part of my process. But you, as the client, whoever was watching this, you may wonder, what is your therapist writing down? What are they writing about me? That's what I wrote up here. And so I wanted to share just a little bit about my process as far as note taking in a session. I'm going to draw a happy little piece of paper here to represent the notepad I may use, or recently I switched over to trying out an iPad and doing things digitally. But I will note um, with just a simple initial, just a letter in the corner, first initial of who I'm meeting with during this time period. Maybe that's 1:30 in the day, and that way it's just enough information for me to know who I'm meeting with, while it's also protecting that confidentiality. I make sure that nobody else is seeing these notes and that they get shredded. At the same time, it's just an extra layer of protection. I just put that one letter there to denote what that time period is, and so that protects you, the client. I note when times start and when times end. And so maybe I'm starting 1:31 for a 1:30 session. Maybe I'm ending it at 2:28 for that session. I aim to keep sessions about 53 minutes in length, but I'm really bad at doing that and tend to run over at least by a few minutes. I do try to end by the hour. Um, but yeah, so denoting the time of the session, that's what I do there. And then alongside the side here, if anyone were to pay attention, if you happen to see my notes or my clipboard when I'm writing, or my notepad when I'm writing, I will put down things that I want to talk about during the session. I like to review my previous note or previous intake before a session that I go into. It's rare that I'm just jumping in, flying on the seat of my pants in a session. Not that that may not happen, but I really prefer to go in having reviewed what did we talk about before going in, so I'm not knowledgeable, that I can follow up. Um, it's like if you were to if you haven't watched a TV show in a couple weeks, you might need that reminder of what was that recap from the last episode. So I like to get that recap before a session, usually at some point, either earlier in the day or maybe the night before, to review that. And so I like to write some things down along this side as far as what are some techniques that I may have in mind, what is some direction that I want us to go, what are some maybe insights that maybe I'm having or where I want my client to get during the sessions. That's usually what I put along this side here. And then there's some other information that I'll explain some here. I'm just going to write this out the way I've at least lately tended to be doing my notes. And so if there's any therapists watching, I don't know, you might think, hey, maybe that's an idea you could try. I don't know. I like to learn things and I like to pass along the things that I'm learning. Hey, that's why I'm making this channel. So I do sort of a modified SOAP note. If you know things in the clinical realm, you might have heard SOAP note before. Um, but what the O stands for here is the objective, and what that means is that on this line I'm writing about the visible things about a client, what kind of typically I'm going with what's the emotional state that a client is coming in with, what are the observable things that the client is coming in with, and so I'm sticking with what are those observable, like observable facts that can go there. Oftentimes I'll put what is that emotional state that the client is in. Do they appear distressed? Do they appear anxious? Do they appear calm? Does this change at all during a session? I'll note those things there. And so as I'm working with a client, I'm observing what is that mood state during the session, what is happening maybe behaviorally during the session, and jot down some notes regarding that. I do notes typically on paper, or again recently the iPad, and then I put them into our portal that we have. And so I type up whatever was handwritten here, and I put that in so that it fits with our EMR system. We have a record system, and so there's a format in there, and so I plug it into that, and then it gets submitted for payment for insurance. And so that's how that process works. But the S here stands for subjective, and so that is the client's stuff. And so this is what the client is sharing during the session. Do some squiggly lines here to denote that stuff. So what you, the client, are talking about during the session, things that stick out to me. What's going on in your life? What are you stressed about? What kind of symptoms are you experiencing? What are the things that pertain to the treatment we're doing here? How did you follow up with homework or not? What are barriers to that? What kind of good changes are happening? What kind of not so good stuff is happening? Any of that is fair game for what I'm going to put in this section of the note that gets transferred over when I put the note into the portal system. All of this does. So that is what's going on with you. So if you're wondering what is my therapist writing down, it might be a direct quote from what you have said. I know that insurance, anybody who might end up if something were to be audited, if this is going to insurance, an auditor would want to see a direct quotation there, as that just lends more evidence to the fact that this session actually happened and it isn't something that's like fraudulent or made up. But also it shows, it sticks to what's going on with the client rather than the therapist's like interpretation of it. So that in that section we want to stick with as much as just what's coming from you, the client, as possible. This isn't the section for our own interpretations of things. Now down here I have this numbered, and what I did 1, 2, 3, 4, and this is where I put my interventions, my part of this. And so in the past, working in a school-based setting, we would bill Medicaid, and I know from my training with that is that they like to see an intervention basically for every 15-minute period of time, and that's something that really stuck with me, as what would I say I did in the last 15 minutes or in this 15-minute section of a session. And so I keep track of those things here. And so we've got what's going on, what is the client sharing. Often this stuff relates directly to what is the intervention, what is my role in what I'm doing with the client right now. Am I using some sort of CBT-based technique? Am I using something that draws upon some Gottman work if I'm working with a couple, or something EFT related if I'm guiding a couple in an enactment, if we're working on processing what's going on emotionally and things like that. I'll put in that stuff here, and so I'm aiming to have about 4 interventions there. That's not something that's I don't believe is needed for insurance, but I tend to aim for more in my documentation than less in that way. I like to really show what I'm doing in my work here. Um, the last piece here is there's the homework and my plan for treatment. Sometimes these things just may overlap, but I like to talk about homework with clients. I have a bunch of binders here next to me. You can't see them. I'll lift one up here. Hey, there's a binder. I like to give handouts. I like to create handouts. Um, Whether it's things I find on the internet or things I pull from books or just coming up with something maybe entirely new. I do like to create stuff to give to you or have something to give to you so you'd have something tangible to work on. Some people like homework and handouts, some people don't. I like to gauge that and I just go with the flow with whatever's going to work for you. But if nothing else, I do want to be talking homework, follow up. What can you be doing in the time in between sessions? Because I only see you 1 hour in a week or 1 hour in 2 weeks, 3 weeks, 4 weeks, depending on what your frequency is. And so for therapy to have the most power, the most sticking effect, it really needs to be something that you're doing, taking what you're learning in here and practicing it outside of here, trying out a new behavior, trying out a new way of being, something that you can take out of here. So we'll talk about that in session, and then I write it down here. And then as far as planning, maybe if there's particular areas to go with treatment, if I've got treatment plan ideas for where I want to be going or any new thoughts about that, I'll put that in the plan section. You know, that pretty much covers what I'm documenting during a session. Certainly if there's risk, if there's talk of suicide or harm or something like that, I want to get that in the subjective section. If there's anything observable that's concerning behavior, that would go in the objective section up there, or just jot it down wherever on the sheet if I have room. I also will write out just dynamics that are going on or things that I'm trying to keep track of. So sometimes this can get kind of messy or full, and I probably tend to over document maybe compared to some people, and maybe I'll rein that in someday. Less is more. But so far, I tend to like to write things down, and that helps me just track with you as the client. And I'd like to think that it shows that I'm paying attention, that I'm like actively staying in there with you, listening to you, taking in what you're sharing. So I'd like to think that it's a strength that I do this. Rather than being a barrier to connection. Certainly, if whoever's watching this, if you're ever a client like, dang Sean, you take too many notes, like eyes up here, you're looking at your notepad too much, you can let me know. I always encourage feedback. If you've got any feedback for me, if you've got any criticisms for me, please let me know. I want to work with you on that. I want to make any repairs if I ever put my foot in my mouth or mess up in some way. You know, we're all human as we're doing this job. So anyway, that was something I thought I would cover today. Doesn't have anything to do with ACT, but I'm using this channel for more than just ACT-based stuff. But there's more ACT-based stuff to come. So thank you for your time. Thank you for showing up today, and I'll see you next time.